Can joint imaging help monitor gout disease progression? Have you ever wondered how doctors keep track of gout disease and its progression? Joint imaging can be a key player in this process. Gout is a type of inflammatory arthritis caused by the buildup of monosodium urate crystals in the joints. This buildup leads to inflammation, pain, and over time, potential damage to the joints. Joint imaging techniques offer a non-invasive way to visualize these changes and assess how the disease is progressing. There are several types of imaging that can be used to monitor gout. One of the most common is ultrasound. This technique can detect urate crystal deposits, known as tophi, as well as joint inflammation and erosions. Ultrasound is particularly sensitive in identifying early changes and can help monitor how well treatments are working. Another advanced imaging method is dual-energy computed tomography, often referred to as dual-energy CORT. This technique can specifically identify urate crystals by distinguishing them from other tissues. This allows for precise mapping of crystal deposits and tracking changes over time. Conventional X-rays are also used, especially in more advanced stages of gout. They can help detect joint damage and erosions but are less effective for spotting early disease or crystal deposits. Magnetic resonance imaging, or MRI, can show changes in soft tissues and bones, but it is less commonly used for gout monitoring due to its higher cost and availability issues. The benefits of using imaging for monitoring gout are significant. It provides objective evidence of the amount of crystal burden and the progression of joint damage. Imaging can also help evaluate how effective treatments are by showing whether urate deposits and inflammation are reducing or stabilizing. Additionally, it can help differentiate gout from other joint diseases that might have similar symptoms. This allows for more personalized treatment adjustments based on the findings from the imaging. However, it is important to note that imaging results should be interpreted alongside clinical symptoms and laboratory tests, such as serum urate levels. Not every patient with gout will need frequent imaging. It is usually reserved for cases where disease progression or treatment response is unclear. Access to advanced imaging techniques like dual-energy CORT may also be limited in some healthcare settings. In conclusion, joint imaging is a valuable tool in managing gout. It provides detailed insights into disease progression and treatment response, complementing clinical assessments. This helps prevent long-term joint damage and disability. If you have gout, discussing imaging options with your healthcare provider can help determine the best approach for your specific situation.